All right, here we go. Hello, everyone, and thank you for watching this webinar on DCPT-MD integration. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information in this presentation is for educational purposes. It's not intended to be legal advice. Target coding does not engage in providing legal services. The information in this presentation, every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. A little bit about myself. Before we get going, my name is Dr. Marty Kotlar. I'm a chiropractor. I'm the president of Target Coding. I'm also a certified professional compliance officer. I'm a certified billing and coding specialist. So I consider myself unconventional because most chiropractors are not certified coders. Most certified coders are not chiropractors. So I take a unique approach to compliance as it relates to billing, coding, documentation, HIPAA, being in the trenches, knowing what it's like to diagnose patients properly and improperly, and now on the other side as an expert in billing and coding, I can marry the two and provide some good, deep insight in being compliant and maximizing reimbursement. You know, I'm not the code guy. A lot of people think I'm the insurance guy, or I'm the the coding guy. No, that's not what I should be labeled. If you want to put a label on me, I'm the compliance guy. That's where we specialize in helping doctors with compliance as it relates to billing, coding, documentation. Target Coding is not a billing company, but some people think we are. Now, if you're looking for a billing company, contact us. We have a relationship with a billing company that we endorse. I write articles to many chiropractic publications and journals. I'm a guest speaker at many state association conferences nationwide. So there's a little bit about myself. Now, DC, PT, MD, acupuncture, nurse practitioner, integration has pros and cons. See, my company, Target Coding, we are not a integrated practice company. There are some companies that all they do is show you how to bring on medical doctors and do injections and weight loss and hormone and physical therapy. That's all that company does. Some companies, that's all they do. So they're going to explain to you a lot of the pros and don't really focus on the cons or the negatives. My company, we accept all practices in a sense as it relates to billing and coding. So if you're just a chiropractic practice, we'll bring you on as a client. If you're MD, DCPT, you could work with us. So it doesn't matter if you're chiro only or integrated. That's why I like to share the negatives. Becoming integrated is not for everyone. Actually, I would say 4 out of 10 doctors that I talk to about integration, I tell them not to do it because I could tell just from my experience and my analysis of their personality and their practice that it's not going to work. There are many doctors that have gone to integration and they stopped and they went back to chiro only. So there's definitely a lot of negatives to this. And be careful. Don't just jump into this. Do your homework. Speak to a lot of people. Find out what's going on. Go visit other offices. These are the things I did before I integrated my practice. I was chiro only for 12 years, and then I went MD, DC, PT, acupuncture, nutrition. We had a nurse doing a lot of services. I did that for 4 years. So I know what it's like to be chiro only. I know what it's like to be integrated. I work with a lot of practices. There's a lot of pros and cons. So the pros are it's a great way to treat patients, adds another clinical approach, adds more services. You'll have more marketing opportunities. The negatives are you're going to need more room. You're going to have much more costs involved. Your staff are going to be confused. You're going to have turnover. It's hard to find providers in certain states. Like I have a client in Ohio, it's taking him 2 years to find a physical therapist. So the turnover of finding could be very stressful. But before you even do it, think about the services you want to provide. That's what I did. I didn't just jump into it. what services do I want to provide? I was in practice, as I mentioned, for 12 years, chiro only. And now I said, I want to become MD-DC-PT. My main focus was cardiovascular disorders. I know that sounds a little unusual, but that's what I wanted to help treat, cardiovascular disorders with certain things that I could not do within my scope of practice as a chiropractor. For example, we wanted to do intravenous vitamin and mineral therapy, chelation therapy. Couldn't do that. You can't do that in any state in the country as a chiropractor. So I needed to bring on medical professionals and a nurse to draw blood and do all that work. Lab analysis, centrifuge down the test tubes, so we did a lot of that. That's what I wanted to do. So think about the services you want to provide before you jump into this. Now, I could tell you the typical transition from a chiropractor to integration is bringing on providers that do treatments for neuromusculoskeletal disorders. That's the most common transition. So your corporate setup, again, I'm not a lawyer. You have to check with a lawyer. This is not legal advice. There are 3 options. You have employer-employee, you have partnership, and rent. So the easiest one is the first one, employer-employee. Those apply to those to chiropractors that are in states where you can employ a medical doctor or PT. Check with your state board. You might not be able to do that. There are a few states that I know very, very well. If you're from Oklahoma or Wyoming, don't ask me about integration. I can't help you. I'm not an expert in certain states. If you're from Montana, I can't tell you how to fill out a workers' comp form. But if you're in certain states that I specialize in, boy, do I know the laws very well. Been doing it a while. So, for example, if you're in New York, you're not allowed as a chiropractor to employ an MD, so you'd have to go to partnership or rent. Or you couldn't even partner with an MD. You could partner with a PT in New York as a chiropractor. So hit me with your questions. Any of you have questions, regardless of what state you're in, Maryland, Texas, hit me with your questions as to the corporate setup. But employer-employee is the easiest way to do it. The employer bills out for all the services, pays employees salary. Partnership is terrific too. If you could find somebody that you love and trust, you could form a partnership. Here's another state, New Jersey. New Jersey, I know very well. Can a medical doctor and a chiropractor, can a chiropractor employ a medical doctor in New Jersey? The answer is no, but you can partner. Can a chiropractor employ a medical doctor in Florida? Yes. In Illinois? Yes. Now, if you're just not sure about jumping into employer-employer partnership, because that's a big step, maybe you just want to rent space. If you're going to rent space, don't base it on patient volume. That would be illegal. Don't base it on fee splitting. That would be violation of anti-kickback. So who can provide services? Well, I break it down according to the American Medical Association. We break it down into 2 categories. QHPs, that's you, chiropractors, medical doctors, PTs. You're trained. You can bill insurance companies if you're a QHP. If you're a clinical staff member, you're also trained, but you're not licensed. Well, I'm sorry. You are licensed with some of these. For example, a nurse is licensed, but a nurse cannot bill insurance companies. So clinical staff are trained by QHPs, but cannot bill out on their own. Next, how do you hire and find QHPs and clinical staff members? This is one of the biggest challenges. I could probably talk 3 hours just on this, but we only have about 10 minutes left. So one of the best things to do is ask your patients, whenever I needed anything in my practice, whether I was looking for if I needed some fixtures to be, electrical fixtures needed to be hung up in my home. If I had a patient that was an electrician, brought him in. If I had a patient that was I was looking for a car, had a patient who was a car dealership, I brought her in or him in. When I was looking for a PT, I started asking my patients. One of my patients had a friend who was looking for work. Part-time. That's all I wanted. I wanted to start off part-time. That's another thing. If you cannot afford a full-time medical doctor at $200,000 a year, find one that'll work part-time. Same thing with a PT. Maybe you're not ready to hire a PT full-time. PTs cost about $80,000 to $100,000 a year. So, well, depending upon where you're at. I have some clients that I just had a client that hired in Wisconsin, hired a PT for $25 an hour. That's a great deal. So ask your patients, contact local professional schools. Check out one doctor I went to the local hospital website, and I searched for doctors on that directory. If you have your own health insurance, take a look at the provider directory and just start calling these places. One doctor I called at the local hospital, I just said, "Hi, my name is Dr. Kotlar. Chiropractor. I'm looking to integrate my practice and bring on medical professionals. Are you interested?" Now, asking patients, calling local professional schools, that's all free, so to speak. If you want to pay, sure, you could pay. There are many internet websites like Indeed. Believe it or not, I've had some clients find their PTs on Craigslist. So once you get into paid services, you'll get more feedback. You want to put an ad in the local paper. You want to hire a placement agency. That's the most expensive, but you'll get the fastest results. And once you start interviewing and speaking to these healthcare professionals, don't beat around the bush. Tell them what they're going to need to do. I'm telling you these things based on my personal experiences and mistakes that I made. There was one point in my practice, we were so busy, I was hiring medical doctors and not vetting them properly, where they were coming, the medical doctor was coming on, a patient would go see the medical doctor for back pain, and the medical doctor was saying, just go home and rest and take some Advil. Whoa, doctor wasn't trained, didn't understand what we do. We don't send patients home with back pain with an ice pack. We have so many healthcare professionals that could take care of that. We had acupuncture, we had physical therapy, we had chiropractic, we had rehab, we had massage. We didn't send patients home and say, take Advil. So that's what happens when we got really busy. I'm sure some of you could relate to that. Tell the provider, when you come on board, here are some of the things you're going to need to do. You're going to be responsible for evaluation, planning, directing, administering treatments. You're going to be responsible for coordinating and delegating and supervising responsibilities to assign supportive staff, communicating and assisting with resolving problems, participating in training, understand and comply with the office compliance manual, understand the office rules, policies, and procedures. You know how to administer the things that we want you to administer. For example, I have a client, he wants his nurse practitioner to do trigger point injections. Well, one of the things I do with my clients is I'll interview the nurse practitioner, get a little feedback, find out what's going on. That's what I typically do. Some of my clients like to have me more deeply involved, so we do that. But on the surface, I talk to the nurse practitioners. And I'll say, hey, how familiar are you with trigger point injections? This one nurse practitioner said, I've never done trigger point injections, and I don't know if I feel comfortable doing them. See, the doctor didn't vet this nurse practitioner. One of the first things he wants this nurse practitioner to do is trigger point injections. He didn't vet her properly. He didn't do a proper interview. She's hired. She's involved. She's already getting paid, and she doesn't know how to do them. The nurse practitioners are excellent healthcare professionals to bring on board, more popular than ever. I don't know how many of you have been to your personal medical doctor's office, but you don't see the medical doctors anymore. My wife tells me every time she goes to a doctor nowadays, she never sees an MD or a DO. It's always a PA or an NP. You don't see the doctors anymore. Next thing you'll need to figure out, unless you work with us, is the whole credentialing with your healthcare providers. You see, in my practice, I wanted all the medical doctors to be in network with all the plans. That's basically the way I did it. That's the way I wanted it done. You don't have to do it that way. I know some of you have your medical doctors out of network with all plans. You have your PTs out of network with all plans. That's okay. It's okay only if it's working for you. In my practice, I wanted all the medical doctors in network with all the plans. That's the approach we took. Now, you could take that approach too, and then if you're not happy with it after a few months, you could drop out of all the plans. So getting in all the plans is time consuming. You're gonna need to hire someone or an internal staff member to help you get provider numbers, credentialing. Some plans it's credentialing and contracting, NPI numbers, P10 numbers, applications, CAQH, the Medicare 855R form. So make sure you go through all those. What are the pros and cons to being in network? There are pros and cons to being in, pros and cons to being out. Go through all of them. Take your time. Don't jump into this. There are so many chiropractors I know that have jumped into MD DCPT and it flopped, it failed, it didn't work. But you know what? Some of those doctors are thrilled because they're booming and growing in their regular chiropractic practice. They tried it. It didn't work. They learned a lot. That's okay. My biggest successes have come from my biggest mistakes. I'm sure a lot of you could relate to that. Okay, so that's the preliminary stuff. Now let's get into the patients, right? New patient comes in, they have to fill out forms. Oh boy, there's a lot of forms. That's the way it goes. There's nothing you can do about it. There are certain forms that are mandatory. You have to get forms filled out. So here's just a few of the regular patient forms. There's a whole bunch of HIPAA forms that you should be aware of. So get good quality forms. This is the HIPAA Notice of Privacy Practices. Make sure you get it signed. Make sure you have an updated one. 99% of the doctors I work with, their HIPAA forms are old, outdated. One doctor I was working with just recently, he shows me his HIPAA form. I guess he never read it. I guess his patients aren't reading it. I guess his staff has never read it. I guess I was the first one to read it. It has all this dental information in it. I asked the doctor, where did you get this? Why does this form have so much dental information in it? He said, Marty, my brother-in-law is a dentist. I just took his. Oh, boy. All right, so patient flow. That's another thing. Who is the patient going to see first? Do you want the patient to see the MD or the DC or the NP or the DO? Can the patient see the physical therapist right off the street? What happens if it's a Medicare patient? Can the PT see the patient right off the street, or does the MD have to see the patient first? Very important, patient flow. Let's say the patient's going to see the MD first. What is the MD going to do? Is the MD going to recommend everything you do? That's another mistake I see. Medical doctor is seeing patients. Every patient needs a TENS machine, a back brace, chiropractic, acupuncture, physical therapy, injections, trigger points. Every single patient needs acupuncture, needs physical therapy, needs chiropractic, needs a back brace, needs a cervical traction device, needs DME. Once you set a pattern of doing the same thing over and over on every patient, that leads to fraud, abuse, overutilization. Now, hold on. A chiropractic adjustment on every visit is not a problem. I'm not talking about, oh, yeah, I adjust patients on every visit. That's a problem? No, no, no. So the common services in typical integrated practices include physical therapy services. So here are the PT eval codes. There used to be one. Now the PTs have 3 evaluation codes and 1 reevaluation code. You're going to have your physical therapist doing modalities. Make sure that they understand what these codes mean and what they do, and they're not spending time. You see, that's another thing. I see doctors and PTs and then pees in the room for too long, and it doesn't become profitable. If you have a physical therapist in the room with a patient for an hour and you're collecting $70 for that entire encounter and you're paying the PT $50 an hour, you just lost money on that visit. So when you have a PT going into a room and spending an hour with a patient doing mechanical traction, unattended stim, what's going on? You need to be profitable, right? If you're not profitable, then you could be the best doctor in the world. If you're not profitable, you're going to have to close your doors. So make sure your PTs understand these are not one-on-one. They're not time-based. Constant attend modalities, yes, these are time-based. These require one-on-one contact. Make sure your PT knows. Now, the most common one is ultrasound. Therapeutic procedures, also make sure your physical therapist understands the application of clinical skills. We're not going to go through all of these. This isn't a physical therapy webinar. If you want to listen more to our physical therapy stuff, just go to our YouTube channel. You could learn more about each of these codes. But these are active codes. The patient has to be doing the actual exercise for 110, 112, and 530, massage and manual therapy. Those are passive. Now, if your PT is doing manual therapy, don't worry about the CCI edit, because there really isn't a CCI edit on manual therapy with most of the codes that the PTs provide, but you know there is one with Chiro. Acupuncture, terrific. This was one of the first healthcare professionals we brought in to my integrated practice was acupuncture. There are 4 acupuncture codes. 2 are with stim, 2 are without stim. 2 are for the initial encounter, and then 2 are for subsequent encounters with reinsertion of needles. These are 15-minute time codes, hard 15 minutes, I call it. You don't get the 8 to 22-minute range like the PTs do with their services. Acupuncture, 15 minutes. If your acupuncturist is not in the room for 15 minutes, I said 15. If it's 14, it's not okay. 15 minutes, then if you don't have the acupuncture in the room with the patient, now it doesn't have to be continuous. You could have the acupuncturist go into the room for 5 minutes, put the needles in, walk away, come back in the room for another 10 minutes, then you're okay. Trigger point injections, very common, very nice, pays well, very simple. This should not be too complicated. I've seen these done numerous times. 20553 is the most common trigger point code, multiple trigger points. It's simple, it's easy. Nurse practitioners should be able to do them. My medical doctor did them all the time. Now, it's interesting. In the beginning, my medical doctor didn't know how to do, well, one of my medical doctors did not know how to do trigger point injections. He never did them. He was in a hospital setting. He worked in the emergency room. He didn't really do them. So we helped train him. The first few patients, I would palpate the trigger point to it, and he would just do the injection. And we used Traumeel. We didn't use lidocaine. We didn't use any medications in my practice. We were a holistic medical facility. That included chiropractic, acupuncture, massage. We didn't prescribe medication. Everything we did was holistic and natural. Joint injections, we didn't do, but this is also very common. This is where you typically are going to use some sort of invasive chemical, steroid. These pay very well. Medicare pays for them. Again, you need an MD or a DO or a nurse practitioner or a PA. Chiros and physical therapists cannot do joint injections. They pay well. Some are with guidance, some are without guidance. And the codes can range from small joints like fingers and toes, medium joints like a wrist and an elbow, and then large joints like knee and hip. Probably want guidance. NCVs and EMGs still around, still get paid, not like they used to. Get your doctors trained. You want to use an outside company, that's fine. You want to do the TCPC component, careful with that. You want to rent space to a diagnostic mobile testing company, run that by us. You want to employ an independent contractor for the day and you do all the billing, talk to us about that. There's a lot of different ways to arrange that. nutritional consults. We did these all the time. Now, in my chiro-only practice, I never did these for a couple of reasons. One, it was too time consuming and the reimbursement wasn't profitable. And there were other reasons, but when I brought on a nutritionist and when I brought on a chiropractor that was a certified clinical nutritionist and registered dietitian, we would bill for it. This is here's a little Q&A question. How do I document for going over lab work, nutritional consultations, and selling vitamins? Are these services and products covered by insurance? Answer. Going over lab work, nutritional consults with the patient, that includes results, prognosis, and possibly risks and treatment benefits, instructions for follow-up, importance of compliance, can be considered counseling and coordination of care. In this case, time is considered the key component. So if you elect to report a service on counseling and coordinating care, document the face-to-face time. Example, 15 minutes would be a 213. Now, those of you that are doing more than just typical neuromusculoskeletal treatments like back pain, neck pain, headaches, and you get into more maybe nutritional services, more functional medicine, maybe brain-based services. We work with doctors all the time. One of the things we do is provide you with the ICD-10 codes that you might not even know exist. Like we have clients that do a lot of nutritional work, and a lot of patients come in that are dehydrated. That's E86.0. Now, dry mouth is part of dehydration, but if dry mouth is not due to dehydration, then you wouldn't use E86.0. You would use R68.2. You're treating a patient with, let's say, difficulty sleeping, insomnia. One of the most common things I hear from my friends is that they can't sleep. My friends tell me every morning they wake up and they have a whole discussion with their spouse about how horrible their sleep was. So there are diagnosis codes for that, and chiropractors treat this stuff all the time. Sleepwalking, that's a good one, right? F51.3. Sleep disorder, G47.9. A lot of my clients work with kids, adolescents going through puberty. I have all these different menstrual disorders and nutritionals, and a lot of these young kids, 13, 14, 15, they're walking around with brain fog and just stressed. So yeah, they have some sort of menstrual cycle disorder. Here we go. PMS is N94.3, Mittelschmerz N94.0. And then, there are many other things you could do in an integrated practice. Prolotherapy, hormone injections, biofeedback, hyperbaric oxygen therapy, weight loss. These are all the things you can do and we can help you with if you have questions on them. Now, in an integrated practice, make sure you have a compliance plan, especially if you are going to be treating Medicare patients. Most of the doctors that I work with treat Medicare patients with the knee injections. Also, there's a little heads up. There's a P-stim device that goes into the ear. Some chiropractors are billing Medicare for that and getting paid $3,000, $4,000, $5,000, $6,000 for the P-stim, the Stevax device. Please do your due diligence. Talk to us about it. Contact us. We'll talk to you about our experience with that and what's going on with that. There's some very important issues. If you are using that P-stim Stevax and you're getting paid $3,000, $4,000, $5,000, $6,000 from Medicare for that device, contact us for a free consultation. We'll give you a little heads up as to what's going on with that. So the OIG, yeah, speaking of Medicare and DME, that's one of the things the OIG looks at, DME, chiropractic services. The OIG looks to protect the federally funded programs from criminals ripping them off, right? You probably have heard of criminals ripping off Medicare and Medicaid with many different scammy schemes. So Medicare wants you to be proactive. Medicare says compliance manuals are mandatory. just haven't provided the implementation date. But get a Medicare manual if you see Medicare patients. Do it on your own. Try your best. Your state association might be able to assist you. Maybe you can go online and get some forms, but start putting together a compliance manual on billing and coding, even if you don't see Medicare patients. Put together a simple billing and coding compliance manual. Start working on it. Put it on your list of things to do. Now, if you're just too busy and your staff is too busy and you just don't have the wherewithal to put it together, then contact us. We do them all the time. They're not complicated. Putting together a billing and coding policy manual, we've done all the heavy lifting. We just have to customize it for certain things you do in your practice, like if you do Pedibond, you do CBP, if you adjust full spine, but you only bill for 98940. Do you do laser? Do you do decompression? What's your policy on staff trade? We put it together. We do it all for you. These are all the sample policies here. Also with integration, practice integration, make sure you're not violating the Stark Law. You cannot send patients to another facility that you have financial interest in for certain designated health services. There they are on the screen. Also, don't get involved with getting paid for patients. You shouldn't. The anti-kickback law makes it illegal to give payment or receive payment in exchange for patients. There's a good reference there at the bottom. Look into it. Prompt pay. So you have a patient that comes in, regular insurance, let's say, or your regular fee is, let's say, $100, and the patient says, hey, could I give a discount? The old terms were time of service, really doesn't get used. In the industry, the term now is called prompt pay. Time of service is really not used that much, or administrative fee. So yeah, you can give a little bit of a discount. Now, I hear that all the time, Dr. Kotlar. How much could I discount? A patient comes in, my normal fee is $100. I want to give the patient a break. How much could I give them? Could I give them 20% off? Could I give them 40% off? Could I give them 80% off? Could I give it away for free? How much of a discount could I give? I hear all the time, I can't. I go to different seminars. Nobody can give me a straight answer. What say you, Dr. Kotlar? I say, go to any reliable resource that you could find and get something in black and white. Start with that, because when you say, well, I heard I can give 40% off, or I heard I could do this, and I heard, fine, that's okay. Do your research, but until you get something in writing, you are gambling. So I have something in writing. This is right from the OIG, from the federal government on prompt pay discounts. Here it is. Also, the $75 rule. I hear that. Dr. Kotlar, could I give away a free exam? Could I give away free x-rays? What's the deal? Could I give a patient, if a patient refers a patient, could I give them a $100 gift card to Starbucks or to Macy's to go buy something? What's the deal? Well, go do your research. Ask your state associations. We have positions from many state associations. We've been doing this a while. We are always researching, trying to find out the answers. So ask your state association. If you're a member of Target Coding, we will take care of it for you. But for non-members, ask your state association, ask the ACA, ask your attorney, ask around what the deal is on free care, and get stuff in writing. Now you're asking me? I found something in writing right from the OIG, right? This is part of an OIG manual. This chiropractor had to pay nearly $80,000 in fines because he was giving away free electrical stim to his Medicare patients. So, a little bit about HIPAA. If you're a covered entity, you have to abide by HIPAA. How do you know you're a covered entity? Do you bill or receive payment from insurance companies? You're a covered entity. Do you submit claims electronically? You're a covered entity. Now you might say, well, I'm a cash practice. I don't have any employees. I don't even use a computer. Okay, so maybe you're not. Maybe HIPAA doesn't apply, but I could tell you, HIPAA, I've been doing this a while. HIPAA applies to 99.9% of you listening to this. So here's a whole bunch of things on HIPAA. Can you have sign-in sheets? Can you email patients? Do you have backup procedures in place? That's mandatory. HIPAA federal law says you have to have a backup of your patient data. So if you're backing up to the cloud, good. A lot of you might say, sure, I have an external hard drive. I back up to the cloud. I have a backup service that I use. Great. So you're saying that. It has to be in writing. It has to be on paper in a policy. So here's all the HIPAA forms and policies on antivirus software. HIPAA is about protecting patient information. It has nothing to do with billing. It's about securing your laptops, encrypting your software, making sure you have passwords for all your staff, making sure you tell your staff to speak quietly in the waiting room, making sure you have everybody sign off on the policies and procedures on who could access your computer, what type of HIPAA training have they gone through, what happens if the patient files a HIPAA complaint against you, what processes do you have in place. This is all mandatory. And I'm not saying this to scare you. I know there are some doctors, coding people, they get up there and they scare you. I'm not scaring you. I'm just trying to educate you on what's happening. And these are trends. HIPAA was not an issue until recently. HIPAA has been around 20 years, but now it's in the forefront. So if you see a trend, like with clothing, you see a trend, everybody's going to be wearing these clothes, you're probably going to want to buy the clothes so you could show everybody, look, I'm trendy. I know what's going on. When it comes to clothes or cars or jewelry, everybody wants the latest and, trend. Well, I'm telling you, there's a trend right now. HIPAA and billing and coding compliance, it's going to get more put on the front burner. So if you see a trend coming, why don't you heed it accordingly? So start by going to this website. Try everything on your own. That's my recommendation. Try doing HIPAA on your own. Here's a great website. Start checking it out. You have to do a security risk assessment when you're dealing with HIPAA. Try doing it on your own. You may be able to figure this out. Go for it. Do it. Now, if you start doing it and it's becoming too voluminous and comprehensive, then contact us. You don't want to work with us? That's okay. Find someone else. So do a security risk assessment. Get those formal trainings in place, especially in an integrated practice, because what's going to happen is you're going to get busier. You're going to be bringing in more money. The more money you bring in, the more protection you need. See, if you're a single chiropractor, let's say you're 23 years old or 26 years old, I don't know. You're a young chiropractor, single. You don't really need $10 million in life insurance. If you're married, you have kids, you have 2 homes, you have 3 cars, you may need a large life insurance policy plan. The more you have, the more you have to protect. Same thing in practice. If you have a practice where you're seeing 10 people a month and you're the only chiropractor, you don't have staff, and you see 10 people a month, HIPAA is not going to be as much a priority as if you're seeing 100 a week, or if you're in a multi-specialty practice. The biggest problems I see in a multi-specialty practice is the right hand doesn't know what the left hand is doing. So here's my little 9-step action plan. Get proactive. Review all the new patient paperwork before you see the patient. Make sure the patient signs all the forms. Step 4, review the policies from the plans you bill. Step 5, understand the what and the why. The what is your CPT codes. The why is your diagnosis codes. Do a self-test on your soap notes. Don't wait for the oil light to flash on the dashboard. Get out of the car, open up the hood, and check the oil before the light goes on. That's what compliance is all about. Find out what a medically necessary soap note looks like. Find out what a billing compliance plan looks like. Incorporate that. Audits, prepayment. I just wrote an article in yesterday's my news. Every month I put out a newsletter. Yesterday's newsletter was all about prepayment audits. Those of you that are not familiar with prepayment, well, you're probably familiar with post-payment audit. Prepayment audits are relatively new, and they're happening at an accelerated rate. One insurance company just hired 19 auditors to do prepayment reviews, so they know it's profitable. Put together a simple policy. Step 8, put together a simple policy manual. Step 9, conduct regular staff meetings with staff that do your billing, especially to the insurance companies that pay you the most. I call it the 35% rule. If you're collecting more than 35% from one particular insurance company of your total income, you must do a billing and coding policy manual based on that insurance company's policies on chiropractic. I have a client. His practice is right next door to a building, AT&T building, 300 employees. They all have Cigna. 80% of his practice are these AT&T employees. Guess what? He's being audited. He's on a claim block. Right now, overnight, he has lost 80% of his income. If he had a compliance plan in place, it wouldn't be happening. So do this so you could SWAN. You see that? SWAN, that's my favorite acronym. SWAN means sleep well at night. Sleep well at night. So just a few closing comments. Here's my direct email, website. Besides these webinars, we do seminars and we sell videos. We do on-site consulting. We have membership programs. We sell forms, letters, templates. Here's our chiropractic, Medicare, and HIPAA forums, logs, and templates. There's some physical therapy forms in here, acupuncture forms, Medicare forms, sample soap notes. Those of you looking for a billing company, I get this question all the time. Dr. Kotlar, who do you recommend for billing? Here we go. ACOM Health. Check them out. Speak to Michelle Carmody. If you want more information about ACOM's billing service, you can contact me or you can contact Michelle at ACOM. If you do that, mention the exclusive opportunity for target coding clients and webinar attendees. It's a $1,000 value special. You get a free billing analysis. We have a book that we sell on the best CPT and ICD-10 codes to maximize reimbursement. All right. Let's go take a look and see what questions have come in.